Hello friends, this is Dr. Abdi. In this video I want to share the results of a study that has been published in Critical Review in Food Science and Nutrition Journal, one of the best journals in food and nutrition circumstances. The title is about the effects of ginger intake on weight loss and metabolic profiles among overweight and obese subjects. The method is systematic review and meta-analysis. The systematic review and meta-analysis study is, maybe we say, the best evidence in medical and health science, one of the highest authenticity of the studies. So in this study, a secondary analysis have been done on 14 studies, 14 RCTs, randomized controlled trial studies, and the results briefly here is the effects of ginger intake on body weight. It reduced body weight significantly, as you see here, and also waist to hip ratio significantly reduced, hip ratio, and also fasting glucose and insulin resistance index. And also it increased significantly HDL cholesterol. Let me explain more about these indexes. As you see here, the ginger is taken by tea, by food, and other supplements. So for body weight, you just simply check your body weight by a measurement like this one. There is no problem. And also this index, waist to hip ratio, shows us the we say obesity, central obesity. So if it would be for male, it would be less than 0.85. For checking it, we put wide circumference. Here you can check waist circumference, and also hip circumference. We put it in the low. We check waist to hip ratio by this formula, and if it would be for male less than 0.85, it is excellent, and for female it would be less than 0.75, it would be great. But those people who this index is more than or equal 0.95, they are at risk of some diseases like diabetes, cardiovascular, and so on. And for females, if it would be our 0.86, they would be at risk. Okay, another index is hip ratio, and you can check it based on the centimeter. And if it would be less than 95 centimeter, it would be great for male people, and less than 0.80 or 80 centimeter, it would be great for women. Another index is fasting blood sugar. If someone would be fast for 8 to 12 hours, and after that blood is drawn and blood test is taken from these people, and the FBS or fasting blood sugar, the normal range is 80 to 100 milligram per deciliter. And if it would be our 100 to 125, they are pre-diabetic. And if it would be our 126 or 126 plus, they have diabetes, and they should have complementary tests. Another index is insulin resistance index. If the insulin resistance index would be high, the patients are at risk of diabetes. And type 2 diabetes is associated with insulin resistance, and the main cause of type 2 diabetes is insulin resistance. So if we check the insulin resistance index by this formula, we can check it, but the normal range is less than 2.5. And if we have, for example, more than 8, it would be very insulin resistant and they are at risk of diabetes. So as I said, ginger intake and consumption reduced all of these indexes. Another index is HDL, or high density lipoprotein. High density lipoprotein, we say good lipid. Good lipid, if it would be very low, it is dangerous, and some cardiovascular diseases will be happen, like coronary artery disease. The optimal level is more than 60 milligram per deciliter. But the question is, how much ginger should be eaten in a day? The research show that 1 to 4 grams per day is great, and it is almost equal to 1 teaspoon of fresh ginger. Or if someone used the ginger powder, it is better to use uh, one half of teaspoon. It is about 1 to 3 gram per day. It is great. But some contraindications or precautions for ginger, we should consider these precautions. For example, about GI problems. Some people that has heartburn or gastrointestinal bleeding or gastrointestinal sore, these people should not use ginger without without consulting the physicians. And also about the pregnant patient, pregnant woman and breastfeeding woman, those women that breastfeed their children, their neonate. So these are dangerous if they use ginger without uh, consulting their physicians. And about some people that has heart failure, because heart failure patients has a low blood pressure, and ginger lower their blood pressure, so their cardiovascular system would be compromised. So they should have a consultant with their physicians. And also about those patients that have bleeding disorders, or they have surgery, or probably they are going to have surgery in future, in near future. So they should not use ginger, or if they want to have ginger, they should have a consulting with their physicians. Okay, friends, hope you use the results of these studies and my explanations. If you have any questions, please send me a message, and surely I can I try to respond you by authentic evidence. Have a great time. Bye.